At the Center for Pain Control, Gabriele Jasper, MD, has created a state-of-the-art facility for his patients. With 2 offices to serve you in Ocean and Middlesex counties, you will be greeted by a friendly and knowledgeable staff that will situate you in the large, welcoming lobby and will assist you with any questions you may have. You will be accommodated in the spacious exam rooms, surrounded by imaging equipment that uses leading-edge technology. Dr. Gabriele Jasper uses the latest information available for his diagnosis consultations and is knowledgeable in what the field of interventional pain management has to offer. Doctors from across the United States, Europe, and the Far East have consulted with Dr. Gabriele Jasper on his pioneering work in the field of non-surgical pain management. For your convenience, most of the testing and medical procedures are done on site on an outpatient basis. When you meet with Dr. Gabriele Jasper, you will receive one-on-one attention during your consultation, where the doctor will thoroughly explain your condition and the treatment options that are available to you. Dr. Gabriele Jasper believes that everyone should experience relief from pain, and he will do everything in his power to achieve this for each and every one of his patients. So give the office a call today and take your first step towards a better quality of life you deserve.
This gentleman has a herniated disc in the cervical spine in his neck with radicular pain, which means he has some pinched nerves, which are inflamed. I'm going to do an intralaminar epidural, cervical epidural. We have the, open it up. We have the x-ray lined up. We want to stay at the lower part of the cervical spine between the thoracic and the cervical. Rotate it a little bit toward his head. We're going to open up the intralaminar space, which is right here, with a lighter color intralaminar space. Stop. We line it up at the tip of the needle. Is the pain worse on your right or left side?
Left.
Left side. So we're going to tend to stay on the left of the spinous process. You're going to get a pinch. This is numbing medication. So we're using fluoroscopic guidance to guarantee the accuracy of the injection, the direction of the needle. We steer it down. We got to go to the right and down a little bit. That's bullseye. We're going to go straight down until we get to the ligamentum flavum. I feel a little pressure, a little resistance. Now I'm going to use, the other method is a glass syringe with a little normal saline and air in it for a loss of resistance technique. Put direct pressure on the plunger. Check and see if I'm in. There's pressure there. So we're going to use direct pressure. I use constant pressure until we have loss of resistance. You can check the direction. I feel a little resistance. So we're probably up against the bone. I'm going to change the direction. Constant pressure. Loss of resistance. Okay, we're right where we want to be. Now we're going to check it again with dye and make sure it's in the right spot. Make sure it's not in a blood vessel. Make sure it's not in the arachnoid space. Perfect characteristic pattern of epidural space. No evidence of intravascular injection and no evidence of intrathecal injection. Now we're going to inject normal saline and Kenalog, the steroid. And we're done.